We're back, everybody, on this Thursday night. Rhori Johnston sitting in the chair here on OpenLine, News Channel 5. Plus, our guest tonight is the Commissioner of the Department of Mental Health and Substance Abuse Services here in Tennessee, Rhori Williams. We welcome her back. And I should point out, Rhori, this is what, you've been 5.5 years? Even before Governor Lee, you were with Governor Haslam. You're rolling right along. You've seen a lot over 5.5 years.
I've seen a whole lot, and I was extremely grateful when Governor Lee asked if I would stay on as his commissioner. My background is in this field. I'm a licensed clinical social worker, and I started my career in Memphis as a case manager, working with the mental health center there, working with individuals that were homeless, that were struggling with mental illness and also substance addiction.
Okay.
And so this is a calling to me. So to be able to be asked to stay on and be a part of an incredible team at the department and with the governor's office, I just beyond grateful for that. Good.
I should point out to viewers too, you notice our screen in the background is back. It's working.
He came back.
Great job to Emila. Yeah, she said, don't jinx it in my ear. So listen, you've been there 5.5 years, and you talked about, over 15 years that your department has grown, you said about 75%. First of all, I want to ask, why do you think that is? And second, you have to go before the governor every year to present your budget. And I'm sure every year, almost every year, because of the need, your budget grows and you want to provide more. And how does that work? How you said before that overall you feel supported.
Absolutely. So, Rhori, I've actually been at the department for almost 21 years.
Okay.
I came back in the year 2000 and started Creating Homes Initiative when I came in. And so I have seen us completely grow, change, shift, expand, enhance. And if you talk to other commissioners across the country and you look at our array of services, we have every array of service that you could hope to have. One of the things that we're attempting to do, which is why I talk about the enhanced budget, is to make sure that that service array is available whether you're in a rural community. So whether you're coming from Crockett County or Haywood County or another county, as much as if you're in Davidson County, an urban county, to make sure that those services are available. And how have they grown? Twofold. We have an amazing team at our department, and that team does not have to write grants outside of what we get. But we have been writing federal grants to augment and supplement state dollars.
Boy, you just answered my. I just wrote down federal dollars ? Grants ? So keep going on that because that's so important.
So it is so important, and I'm so proud of our team for actually doing that. We have a chart that we show that shows the climb in federal dollars and then the climb in state dollars. And I will tell you that in addition to the federal dollars that we've seen increase, our state has been more supportive over the last 6-7 years as far as the legislature and the governor than we have seen in years prior.
And would you,
the funding. Yes,
Commissioner, would you tie that support over the last 6-7 years, and not to count the pandemic, which we're going to get into because it's really important the last 2 years, but would you tie some of that into just the fact in our society, it seems, and we've talked about mental health, covered a lot of mental health topics here on OpenLine, which we think is important because we want to kind of pull it out of the shadows. It just seems that, and we're still not there yet, but we're trying to, people are a little more comfortable. And I've told my friends, I occasionally call up my therapist if I want to talk about it. And I'm not shy about saying it. You go to the gym to work on your physical health, and there are ways that you can work on your mental health. It's so very important. And I think it really is becoming less of a taboo subject. it's becoming more mainstream, and we're realizing how important it is. You tie those things together, how the legislature is saying, you know what, we've got to get on board here and start to fund these programs.
I'll tell you, I'll tie a couple of things with that. Number one, just what you said, Rhori, there is less and less stigma around saying, I have a problem I'd like to talk about. It does not make me any different than if I called you and said I had a heart issue and I need to talk about that. We see actors, we see athletes, we see singers, we see business leaders saying, hey, everyone struggles at some point in their life, and really a large majority of people are going to either struggle with a mental health concern or have someone that they love struggle.
Right.
And so the more people that are willing to come out and say, hey, this is something I call my therapist. I do a routine checkup, like you were saying, to see how things are going in that area. The other thing that we're seeing is the outcomes. If you look at the different ways in which we can intervene and truly make a difference and have more recovery in individuals' lives, I think our legislature and our governor, who's really focused on outcomes, we are showing a huge return on investment. Just to give you an idea, if you look at the emergency department, let's say you go to the emergency department, you're struggling with a mental health crisis. If a person doesn't intervene there through our system, where you've got wraparound services, case management, care coordination, you can go to a walk-in center, then that person's aptitude of continuing to come back through the emergency department is going to continue. Let's say the person comes back 5 times in a year. That in and of itself could equal up to $10,000 of just emergency department visit per day, right? But then if that same person gets intervention and they're able to access treatment, they're able to access case management, they're able to access detox, then that person's not going to cost the same amount of money in a higher cost setting, and not only a higher cost setting, but an inappropriate setting. So they're going to get what they need. It's going to be lower cost to the community and to the state, and it's going to be incredible to that person, their family, their loved ones, and anyone that comes after them. So I think the outcomes that we're seeing, that the governor and the legislature are saying, hey, your providers are doing what's been asked of them.
Right.
We're going to invest in that. If you look at our state hospitals, you know, sometimes people think you may not be getting the same outcomes if you go to a state hospital. You can talk to any person that's had an insurance provider in our state. They will tell you that we have a lower recidivism rate. What that means, Rhori, is somebody coming back into inpatient than the national average.
That's good. That's good.
It means we're connecting people with services that are being paid for if the individual's uninsured, and then services through TennCare. My colleague, Stephen Smith, he's doing so much to make sure that services are available. So I think it's those different areas, Rhori, that impact people's willingness to invest in these programs and services. Yeah,
and you talk about that investment, and really it's kind of makes sense. Pay this amount now, or have not only have a higher cost to the state and all the burdening of different systems, but you know, we're talking about trying to intervene early on with social issues that affect everybody. Not only homelessness, drug abuse and addiction. There's crime that. It goes on and on and on. A lot of it tied to mental health or drug abuse, substance abuse. So to get in there, like you said, early, to recognize it, spot it, and try to treat the long run, the next 5, 10, 20 years is what we're looking at for everybody. We want everybody to be as healthy as possible. Right. You're absolutely right. The other thing I'd say, you know, I was talking about prevention a little bit earlier. Mental Health America, who was kind enough to allow us to have this spot, you know, their work around screenings, where you can literally go on their website and answer a few questions and know, hey, whether there's a concern with anxiety or there might be a concern with depression.
You might have other concerns, cognitive impacts. I can't say enough about them and their work across our state.
Yeah. Okay. We are up against another. Actually, you know what? I got one more question real quick to ask you, because you mentioned something and I'll forget it. You mentioned that you talked to your cohorts in other states. I'm sure you all, I don't know if there's a group with a title, but I'm sure maybe you meet or you talk. Compare and contrast, you learn a lot. We talk a lot here at our station because we have owned by Scripps, and there's a lot of other TV stations. We talk about best practices. We hear about another station doing something that's working out really well or whatever. Tell me a little bit about that. I'm sure people call you up, and it's a flattering thing to have other state leaders call you up and say, hey, tell me a little more about what you're doing there, but also you can do the same.
Oh, I appreciate that, and I'm really glad you absolutely nailed it on the head as it relates to what we do. The association is called the National Association of State Mental Health Program Directors. I'm past president of that executive committee and have been involved in that group for over 20 years in different capacities. When I started out as director and then became assistant commissioner, deputy commissioner, and then commissioner. Not only do we talk about best practices and evidence-based outcome interventions, we also write reports. There's all kinds of things that come out, and we do trade information, talk about these best practices in our national meetings that we hold, as well as our regional meetings. And if you want, I know you said we're at a break. If you want me to come back and say more about that after the break, happy to. I'd love to do that.
Yeah, perfect. All right, we are going to take a break, everybody. Our guest is Marie Williams, Commissioner of the Tennessee Department of Mental Health and Substance Abuse. If you have any questions about services that you may need, or just any general comment, give us a call. We'll be right back.